CVS, the largest drugstore chain in the country, announced it's now going to sell a generic version of an EpiPen made by a competitor. What do you think of that move by CVS?
So look, as we said, competition, we embrace competition. What I would say is the product that they're bringing to the market has been on the market. And it's not a generic of EpiPen, a different product, works differently. And their program's fine. It shows you that, as we said, if you start getting generics into the market, it does bring competition, and that's why we did what we did, cut the price in half. And as I said last year, 90% of all EpiPen patients paid $50 or less. But then you look, you know, just last week, a competitor came back into the market with a list price of $4,500. That's a 900% increase overnight to a competing product.
So why would anybody ever buy that if it's $4,500?
Well, I think their comment was it's $4,500 so people can have access. So as you can see, it doesn't make sense. The system doesn't make sense, but it shows you that brand competition doesn't drive prices down, it drives that higher list price. So to come back onto the market at $4,500, and yes, someone's going to pay that. I mean, the system is going to bear it, and that's the problem. We're crippling the system. We're crippling hardworking families, and we all need to step back and say that this system is not built for how healthcare is delivered today, and we have got to transform that.
But how do you compete against someone like CVS, who's now offering an EpiPen alternative for $100?
Well, and like I said, 90% of our patients are getting EpiPen for $50. So we are competing, and I think, you know, EpiPen's been a tried and true product for over 25 years. It's a life-saving device, and I don't think we should take that lightly. I mean, these are products that need to work within seconds, and you know, you need to be trained on the product. So I think it's important that there is we're, like I said, embrace competition, but I think making sure, again, patients are informed, they understand the product they're receiving and how it works is incredibly important when you're talking about a life-saving device.